colleagues, good day dear dental students. My name is Alexander and I welcome you on our YouTube Rubberdamology channel, where we present you a system of self-education and training application Rubberdam isolation system in the mouth cavity of your patients. Today we have very complex self-training education. We try to set up Rubberdam isolation around fixed retainer to the upper jaw. In the previous exercise, we fix this retainer, orthodontic retainer, to the palatal surfaces of the frontal anterior teeth of the upper jaw with the Rubberdam, and now we try to set Rubberdam again with this orthodontic retainer. It's difficult, it's very complex, but I think it's interesting for you, for your imagination and future clinical planning. Here on our micro camera you can see this retainer. It fixed very well, all teeth connected, and now we start our training. For our education and training, I'm using Nicton Rubberdam plates, and I think this is the best plates for everyday clinical usage and of course education. We're using medium density of these standard Rubberdam plates. First of all, decide which side of plate you can apply to a frame. Then a very important thing, you must decide how to set up and connect Rubberdam to the frame. This is the correct way. This frame has a small curvature on bottom side, and if you see another variant where doctors set up Rubberdam over the metal frame, I think this is not correct. This is idiotism. So be careful with this parameter and work ergonomically, correctly. This is our way. Then what we plan. I want to set up Rubberdam isolation from the 5.15 to 25, and like anchor clamps, I'm using clamp 0 from the company TorVM from the both sides. And first of all, check position and stability of these clamps. In the mouth cavity, in our plastic model, very well. Remove clamps. And now we must decide how to set up our Rubberdam and how we connect them. For anterior tooth, never make perforations upper than this line and below this line. Maintain the center line and the center line of the jaw of the patients. Start to make perforations for molars, for premolars, incisors and canines of the upper jaw. I choose the middle position at the puncture and start to make perforations symmetrically for all tooths from the 5 to 5. Central incisors reduce size of the perforation, but in this case it's no matter. And make lateral incisors, canines, just made your work very symmetrically. First premolar, second premolar. Well, only for education, check this position on your plastic model. Good. Now we continue. I choose the smaller perforation at the my puncher and make additional perforation between working perforations from the both sides at the vestibular and the palatal side, between all perforations. Except last one for anchor clamp. Everywhere where I have retainer, I made additional perforations. Very beautiful pattern. I hope you like it. Watch again at the macro camera and remember what you must do during this exercise. We have two ways how to work next. Connect anchor clamp and the rubber dam traditional way with wings. Because we have a complex education, I choose wing clamps because it's easier and we have enough difficulties today and I don't want to use wingless clamps. It's ready. Then applying and fixing rubber dam at the mouth cavity. Disconnect bottom angle of the frame and hold it with your fingers. Then take one clamp for the left side with your forceps and connect to the second premolar tooth number 25. Very well. Fix this angle and repeat this part for the right side tooth 15. Connect your rubber dam to the angle of the frame. Maybe it's more comfortable for you during the work to connect also lateral fixate retainers. Okay. And we continue. The next we need a surgical instrument. It may be different type of needle holder. I like Castroviejo holder, needle holder. Scissors. Maybe scalpel. It's always useful instrument for education. And one suture. 5-0. Automatic. Also, we need liquid rubber dam and light curing lamp. For home training, it's also possible to use a very simple needle holder, no matter with rings or not, and very simple scissors. It's no matter for our training. course, the standard probe, and we're starting. First of all, detach rubber dam plate from clamp. It's very important. Every time start your work with this stage. Very good. Check interdental contacts with floss. Keep in mind that we did not have any other interdental contacts in other tools because they connected with retainer. Move your floss under clamp and try to make interdental inversion of rubber dam. It's also useful in clinic. Very good. The same from the left side. And now start to work with our rubber dam connection. We need to cut between every big holes and did not touch every small hole. Very nice working. It's like one of variant of split dam. Very nice. And now open your suture. And take your needle holder and start to suture and connect all vestibular perforations of rubber dam with a smaller diameter. Maybe for more beautiful work today, we also take a surgical fillers. Today we have totally surgical instruments. Start to connect. I think it's easier for you to work inside out. First, find and connect perforations from the palatal side. Then very carefully retainer. Then contact point. Working this technique with the natural tools more easier because plastic is very soft and sometimes I fix my needle tip into the plastic of model. With the natural teeth it's impossible. Good. Once suture is ready, maybe you can work with bigger diameter of this sutures, maybe not 505 but 04 is also useful. it's better to make this work from the outer side, vestibular side to inner side. Start your work from the vestibular side to the palatal side. Choose one foramen, then interdental contacts. Yes, it's much easier than the previous variant. No, also not. Make this needle more straight. It's easier to work with more straight needle, like this. I unbend half of this needle, and then from the vestibular side to the palatal side start to working. Small perforations, contact points. Immediately under retainer to the palatal side, remove. Perforations in the rubber dam and back your needle to the vestibular side. Also under the retainer, always. Very good. It's very important to make all this work under retainer. And then make a knot at the vestibular side. We need to repeat this between all tooths. I make only 2 knots. As we have scissors, don't make very short ends. It's easier to locate them next when you remove this. Again, the next suture, I start with this curvature to the palatal. Insert. It's no matter. Try to the traditional way. But it's very important you insert needle under the retainer. Maybe sometimes it's possible you to immediately place perforation to the needle and with one movement move it then back. First knot is tried. Okay. The second. and one. Locate the next perforation. Insert into dental space very carefully. Don't make trauma to gingival. Try to locate perforation immediately with one movement and remove it with one movement. Under the retainer back to the vestibular side. Making knot. And cut unnecessary part of suture. We made a half of work. It's not very fast, but it's not very long. Еще надеюсь. Moving our middle vestibular. Making knot. We have made half of work and move to the left side. it's very useful is if your assistant help you to cut sutures between tooth. It's more faster for you. Very carefully for our gingiva of our patient. Find the path between tooth with this needle. If we have classical orthodontic patient, he have orthodontic position of tooth and good interdental spaces, so it's not any problem for you to find path for your needle between tooth. But on plastic model I have some problems because sometimes I touch the tip of this needle to plastic surface and needle stop. If you broke your suture, don't be afraid. You don't need it for a long time, and this suture will broken. I have only one suture in this knot, but it's stable for 1 hour for my work. It's very good training for your hand skills, for thinking about working algorithm and receiving quality in your adhesion. If you receive any situation that is easier than this, you always use your Rubberdam with any problems. Our very short outcomes. It's easier to work with this material if you have number 40, not 50. Unbend your needle at the half of curvature. It's easier. Make perforations with the different diameters for main perforations for tooth and technical perforations for sutures with the different diameters, because it's very easy to understand which is for what. And then last, apply liquid Rubberdam to the perforations. Maybe I made this with white color. I think it's more interesting for looking. So you can see difference in materials which I use for hermetization. Yes, it's very good. I close all perforations with white material. And then of course cure it. Make additional hermetization at the vestibular site as option for training, why not? Also take a white color of liquid Rubberdam. I remember that I have perforation and correct Rubberdam to close this with liquid Rubberdam. Make a half only from right side and then cure it. Then repeat it from the left side. At the end of this exercise, make an envelope from the both sides to start therapeutical work and discuss some kind of work that we can make with such kind of isolation. What we can do for our patient with this type of work. First of all, let's check about water test. I fill this Rubberdam with water. Very good. It's pretty good. So when we work, they should receive minimal volume of water, any chemicals, hypochlorites or acids, or maybe you decide to work with aluminum oxide because it's very important during, very easy. If we need correction, applying maybe some matrix system in interdental spaces, of course it's possible. uh, interdental wedges. Of course, it's very easy for any kind of work. That's applying agent for treatment of caries if you need it. Also, first of all, and then flushing with water, drying, and we don't care that we have lips and tongue, no problem. And then start to finish our clinical work and detach all this material from our patient. It's better strategy to cut sutures. Removing sutures and then remove clamps only after this. Very carefully from both sides. Very good. Here is our rubber dam and joke for you. Very good, dear doctors, dear students. We finish our 30 exercises for self-training rubber dam in this half of year. I hope you like this methodology. I hope you like these videos and my work for your education and for your knowledge. It's very important to make rubber dam isolation in every clinical case you work every day, every hour with every patient. No matter big big work, clinical work, or small, important or not, you did not have unimportant clinical works. All works is very important. So work every day with rubber dam. Ask your question in the comments below. Don't forget to press the like button and share it with your friends. We have the full free program in our main website rubberdamology.com. Please go to this website, register and finish this education course in this year. Thank you very much.